Hi, everyone. Jessica Ridella and Kevin Kelly here. We are two of the ICO analysts for Bitcoin Market Journal. And today we are going to be discussing a high level overview of dClinic. So, what is dClinic? dClinic is trying to make a shared digital care platform so that patients and caretakers and caregivers can effectively communicate. And an interesting fact here is that the blockchain for healthcare data management has already been, analyzed and given a market share value, and that value is going to reach 1.9 billion by 2025. So this is a huge market space, and actually an incredible application for blockchain. Traditional healthcare systems force organizations, individuals, and caretakers to work in silos with fragmented data. So what dClinic is trying to do is really solve this industry pain point by providing a one-stop platform where instead of silos, a patient's information is collected and shared with both patients and caregivers. And then both patients and caregivers can follow and update progress as it occurs. So we think that the healthcare market is ripe for innovation, and dClinic's platform is truly unique. Specifically, that they're focusing on the Indonesian market. This is a great space for them. They've been building up a lot of partnerships, one specifically with VLM to help them really acquire all of the clinics and hospitals in Indonesia and really gain that market space. And like I said, the dClinic platform is a perfect use case for blockchain and the technology. It's going to really work to help consumers' healthcare data be secure and put that power back to the consumer so that the consumer is the one that is allowing relevant parties to access that data. This is ultimately going to save costs and, eliminate any inefficiencies in data transferring. So we really like the team. They're impressive with many years of experience, not only in IT, but also in the healthcare market. And they have a fantastic advisory board. Some of their partners include Deloitte, KPMG, PwC, the list goes on. And we also really like their token reward system. So Kevin, do you want to talk a bit more about that?
Yeah, so the dClinic platform is going to separate itself from the rest of the health-related blockchain projects in the sense that they want to put the patient first and create like a relationship between the caregivers and the patient. So the way that they're going to do this is with the DHC token. Basically, one of the main purposes of the DHC token is for a reward-based system to occur between the patient and the caregiver. So, for example, a caregiver may prescribe a patient a certain number of calories to intake or certain exercise limits to reach or heart rate to aspire to or what have you, cholesterol to hit. And as that patient completes those tasks and hit those marks, the patient actually receives DHC tokens as a reward. And if, for example, the patient doesn't hit those marks, the doctor or caregiver can send out a reminder or kind of motivate the patient. And then when doctors do that, they actually get rewarded for keeping in contact with the patient and forming that relationship. So this is really putting the patient at the center of the healthcare system, which often doesn't happen. Sometimes when you go to the doctor, you feel like you're almost a nuisance just for being there and just for being sick. So this is going to try to change that. Right now, they haven't completed the platform development. Supposedly, the version 2.0 is going to be ready to go in the first quarter of 2019. Having said that, they do have relationships and signed agreements with a couple of different hospitals in Indonesia where their platform is going to be implemented as soon as it's ready to go. As far as their transparency goes, it's pretty solid. They do have an investor benefit document, which just gives you a rundown of the reasons why it's beneficial to own the DHC token. But overall, very interesting concept in the sense that they want to go after primarily the Indonesian market and provide more of a patient-centric, application for healthcare. So.
Yeah, and like Kevin said, the one area we're a little bit less confident is on their actual blockchain. They're creating their own from scratch, and it's not yet functioning, so it's hard to really be confident about that. But as we've discussed, if they can bring their white paper to life, this is something that's going to completely revolutionize the way patients can interact with caregivers, and we're really excited to see where it goes. So thank you. Keep reading our reports, and happy investing. Okay, bye.